Good morning, my name is Betsy Cuthbertson. I will be demonstrating the assessment techniques today of the lung and chest, the heart, peripheral vascular system, the abdomen, and assessment of muscle strength. I will be using this stethoscope today, so in the places that it requires for me to use the bell, I will adjust the pressure I apply to the stethoscope to use the bell. This is my patient, Sharon Ramsey, and he requests to leave on his socks during the assessment today, so we will accommodate him. And we will begin first with the lung and chest. I will begin by assessing the general appearance of my patient, who is sitting rather relaxed on the examination table. Appropriate facial expressions. His color appears to be normal, tan with pink overtones. There seems to be no nasal flaring or retractions noted in the chest area. There seems to be no use of accessory muscles. His skin is warm and dry. Capillary refill is brisk, less than 3 seconds. There appears to be no clubbing. In the fingers, there's no pursed lip breathing. Have you had any cough lately?
No.
Okay. We'll now move on to assess the respiratory rate. I'll be using the clock on the wall. The respiratory rate is 16. I'm going to now inspect the chest wall. His trachea appears to be midline. It's symmetrical on the chest cavity. Have you had any chest pain recently?
No.
Difficulty breathing?
No.
Okay. I'm going to palpate the chest for crepitus and see if there's any pulsations, lesions, scars, or masses, bulges, and I do not see any. Please let me know if you have any tenderness.
No. No. Mm-mm.
There's no crepitus noted. So at this point, I will auscultate the breath sounds. I'm going to begin with the anterior breath sounds. I'm going to start in the vesicular area up top, moving to the bronchial breath sounds, which are heard over the trachea, and then into the bronchiovesicular breath sounds, which are heard over the main bronchus, and then again to the vesicular breath sounds. And I'll be auscultating from the anterior and posterior sections. If you will, please breathe in and out through your mouth. A full inspiration and expiration every time I move the stethoscope. Let me know if you feel dizzy or lightheaded. Sorry. Breath sounds anteriorly are clear. I'm going to ask you to fold your arms in front of you and take your chin to your chest. Again, full breaths in and out through your mouth. Okay. Make sure not to listen over the scapular area. The breath sounds are clear in all lobes. The chest size appears appropriate. No barrel chest noted. No cyanosis or pallor. Okay. Now we're going to move on to the heart. And again, we're going to begin with the general appearance. Again, color is normal with pink overtones. Skin is warm and dry. Capillary refill, as we said before, is less than 3 seconds, and there's no clubbing noted in the fingers. Now we are going to inspect the precordium. There are no pulsations noted, no masses, lesions, scars noted in the chest area, as we've already said. I'm going to feel for the apical impulse. The apical impulse is noted to be right here. Now I'm going to palpate and auscultate the the carotid arteries. If you will turn your head slightly. And this will be done with the bell of the stethoscope. There are no release heard. If you will, take a deep breath in and hold it. Okay, no release heard there. Now we are going to auscultate the heart for the rate, rhythm, and intensity. The heart rate is 76, regular rhythm, strong beat heard, symmetrical in sound as well. We are now going to auscultate the valves of the heart. We're going to begin with the aortic, excuse me, the pulmonic, go to Erb's point, followed by the tricuspid, and then the mitral, which will be in the aortic is the right second intercostal space, the left second intercostal space for the pulmonic. Erb's point moves down to the third intercostal space, followed by tricuspid at fourth, and the mitral in the fifth. We'll be doing this in 3 positions, in the sitting, supine, and the left lateral recumbent. Okay. We'll just breathe normal. And this is just trying to isolate all the heart sounds, as well as listening for the murmurs, splits, rubs, gallops, and any extra heart sounds like the S3 and S4. Okay. Mr. Ramsey, if you will, please lie down for me. I'm sorry, what?
Which way?
Oh, on your back, I'm sorry.
Back.
To begin with. And again, I'm going to listen to all 5 sites. Beginning with the aortic. Pulmonic. Erb's point. Tricuspid. And the mitral. Okay. If you will lay on your left side with your arm up under your ear, please. And this arm over your head. We will again be listening to all 5. I'm sorry I did not plan on his back beam to you, but we will listen in all 5 spots again. Beginning with the aortic. The pulmonic. Erb's point. Tricuspid. And the mitral. And now we're going to listen as he lays in the left lateral recumbent position with the bell of the stethoscope over the apex to hear for any S3 or S4. And there are no extra heart sounds noted. All right, Mr. Ramsey, if you will sit back on the edge of the bed. We're going to move on to the peripheral vascular system. Again, you're going to be inspecting his general overall appearance. We especially want to pay attention, inspect, and palpate the nails. They are not seen to be brittle. Capillary refill again is brisk. And there's no clubbing noted. Color remains normal. We're going to now inspect for jugular vein distension. If you will, lay flat on your back again. you will look to the left. And again, here I'm just looking for the jugular vein to see if there's any bulges, masses, anything noted on here, any distension, and there is none. You can see the beat occasionally. And if you will turn to the other side, you're going to be assessing the same thing on this side. No distension noted. You can follow the pulsation through. Okay. And now I want to inspect the skin for any varicosities, venous stars, the hair distribution, excuse me, any skin changes, skin color changes as we progress down to the feet. And we also want to check for the texture of his skin to see if there's any ulcerations and to see if he can feel in the lower extremities. There are no irregularities noted. I'm going to pull his sock back just momentarily to check the temperature and the color. The foot is lightly more pale than the rest of his skin, but that is to be expected. Hair distribution is normal throughout. Skin is smooth. We also want to palpate for any edema that we may notice here in the lower extremities. Have you had any pain in your lower extremities, Mr. Ramsey?
No.
There's no edema noted. Okay. We are now going to assess for the peripheral pulses. We'll begin in the brachial areas. If you will, put your arm up over here for me so I can get it at the same time. We'll begin in the brachial area. Both are noted to be equal and strong bilaterally. We're going to move to the radial. Equal and strong bilaterally. We will not be assessing the femoral artery. We're going to move to the popliteal, which is located behind the knee. And they are palpable, equal and strong bilaterally. We'll now move to the posterior tibialis. Which are palpable, equal and strong bilaterally. And then to the dorsalis pedis. Which is also palpable, equal, and strong bilaterally. Since he does have good pulses in his lower extremities, there's no signs of DVT, there's no swelling, redness, or pain that he has complained of. We are now going to move on to the abdomen. We're going to first inspect the abdomen for the shape and distension, if there is any. The shape here is mostly rounded. It is symmetrical on both sides. There is no masses, lesions, abdominal scars noted in the abdominal area. His umbilicus is midline. It is inverted and there's no lesions or scars around that as well. We are now going to auscultate bowel sounds in all four quadrants. Excuse me. We would listen for up to 5 minutes, however, for taping purposes, we will not be doing that. Bowel sounds are active and present in all four quadrants. Now we will auscultate for the bruits along the arteries found in the abdominal cavity. We'll begin with the aortic artery. And this would be done with the Bella stethoscope. We'll then move to the renal arteries. To the iliac arteries. And again, we will not be palpating or auscultating the femoral arteries. I'm now going to palpate his abdomen lightly. If you will, please bend your knees for me. Have you noticed any areas of tenderness lately in your abdomen? Anything of discomfort?
No.
Okay. Please let me know if you feel any discomfort as we do this. Okay. I'm going to ask you to sit back up for me. And then I'm going to percuss over the costovertebral angle. Please let me know if you feel any tenderness at this side. Okay. Any tenderness there,
No.
Mr. Ramsey? Now we will be assessing for muscle strength. What we are going to do here, Mr. Ramsey, is I'm going to ask you to do a series of exercises for me. We're going to be moving certain muscle groups. I'm going to ask you to extend and release, extend and flex, and resist any opposing force that I may exert on you to make sure that all your muscles are moving correctly, okay? We're going to begin with the shoulders. If you will, shrug your shoulders up and down, up and down. Any pain or discomfort?
No.
Okay. Now I'm going to apply pressure down. If you will, try to raise your shoulders up. Okay. You shrug your shoulders and try to prevent me from pushing down. Okay. If you will, put your arms out in front, and if you will flex and extend, flex and extend. Okay. I'm going to be exerting some pressure on your forearm, trying to hold you down. If you will, try to flex. Okay. And then if you will, flex and try not to let me push it down. Same thing with this arm. Okay. Okay. If you will, put your hands out again. If you will, turn them over and then up and down. Fingers apart, back together, apart and back together. Okay. Now I'm going to apply pressure down. If you will, try to prevent me from pushing into to your knees. And same thing up. Now if you will, spread your fingers apart. Try to prevent me from squeezing them together. Okay? You put your fingers together and try to spread them apart. Okay? And if you will, grab my fingers as tightly as you can with both hands. Okay? Now, we're going to move on to the legs. If you will, please swing your leg out and back down, out and down. Okay, try to prevent me from allowing your leg out. Okay, you extend your leg, try to bring it back. Okay, same thing with this one, out, down. Okay, all right. Okay, now if you will, lay down. We're going to be checking your hips. If you will, move your leg out to the side, and if you will, cross it over the other leg and back out to the side and cross. Okay. If you will, resist as I'm pushing your leg. Okay. Bring your leg out and try to pull your leg back together. Okay. We'll do it again to this side. Leg out, crossed over, out, cross over. Okay, if you will, resist and out. Okay. Now we're going to do the feet. If you will point your toes, flex, point, flex. Okay. If you will resist, okay, resist, and point, and now try to flex. Very good. The patient's muscle strength was noted to be full range of motion without or against gravity and with full resistance. This concludes our assessment. Thank you very much.